care delivery and opportunities, but its students felt very strongly around stereotyping.
But can you give me an example of how you designed the case study?
The case study was often used in clinical practice, was consulted with other colleagues who were Māori or Pacifica.
Okay.
So we can co-collaborated, you do it.
Okay.
For the students, you are stereotyping. Now I don't know whether that's generational.
I think so.
But so we've had to go through and remove all of that. And even in our state exam, we are very careful around stereotyping, and that could be any person, that doesn't have to be Māori. So outside of the questions around Te Tiriti, treaty.
Come drunk from outside. So she has to pack the vomit and so many things. She's not used to that culture. But those are the things we use as our own case study. Rather than thinking about, okay, yeah, we can have a case study like that without mentioning that person's
Wow. That really screws up with your brain.
Oh, it does. It is challenging. Although I took breaks.
I'm gonna have to take drugs on the way back because I didn't sleep at all. Our flight's only 8.5 hours.
Wow.
But I didn't sleep at all.
And more recently, as of last year, we've included mental health as a thread. So rather than have bulk teaching, we integrate it throughout the program, throughout the curriculum. And it's been challenging because of the curriculum load that gets overloaded. What do you remove to add something? How do we manage that as academics? Okay. Not only do we have, next slide please.
Yes. In statistics, in girls more than boys, I'm talking about New York State, all this gives to a mental issues.
You have to make it like a story, and I think the story is the best way of deliver knowledge. I may be wrong, but that's my thinking, my own way of thinking. Effect on the development of the child. Let me see if I can go for next. No.
And no connection to the others, our problem. If the child is being born or has a problem physically, I'm going to have a problem with the child. If the child was not challenged during his early lifetime, some of this that we can everybody see, child watching TV 24/7, a child in an iPad for 24/7, that's going to affect the intellectual development, period. I'm going to come to this later on. If the child emotionally was abused or was raised in an environment that do not take care of his emotional needs, I will have a problem. So next please. I have 4 areas as I mentioned, and I could see physical, social, emotional, intellectual. These all areas comes together. If I take one of these out, I have an issue. If one of these got affected, I have an issue. Issue means what? A normal child does not mean that the child is not able to walk, was not able to talk, I should say, was not able to just put the clothes on. A normal child could be physically excellent, but mentally is not, which is a problem. Next, please. Does anyone here in the medical field, guys? Yes? No, maybe? Okay. This is the brain, okay? Straight, briefly, because I don't want to just put too much on that. This is a normal brain. The brain consists of...
I'm teaching a student how to nurse a patient, especially, I'm a mental health, sorry, I forgot to say that, I'm a mental health specialist. So I'm teaching a student how to look after a patient that has schizophrenia, but I never taught them what schizophrenia is. So what do I expect? And how do I expect them to be efficient enough? But because we are not
share why is the AI literacy and self-efficacy
This information, you did that with AI, and you can tell when it's used in a way that used to support your research and to support your writing and as a tool, then I think it's, you know, a great.
using. So for notebook LM, clearly before the starting the semester, I show them
22-year-old indigenous woman.
Otherwise, they opt for the private treatment, they have to be paying for it. Otherwise, rest of the care and the treatment is given free of cost. This is about Tata Memorial Hospital, and all the private hospitals will be charging themselves. So that's what that the workload here and the patients, number of patients in is very much high, maybe at around one.
in the United States is the biggest issue because of urinary catheter, central venous catheter infection. So that's why we all the time meet monthly. So we compare the numbers.
You can browse in, okay, that too in Tata Memorial Hospital. And the second thing is that maybe here we are not practicing that much of adequate hand hygiene. I am so sorry to tell you. And maybe here I came to know one of my friend's mother's cancer bladder treatment was on. This is an experience which I am still sharing with you. And we give pre-antibiotic coverage before installation of BCG to the bladder. That is one of a type of treatment which is supposed to be given for CA bladder. And